In inferior meatus, which structure drains? The nasolacrimal duct. And the middle meatus, all the paranasal sinuses except posterior ethmoid sinus and sphenoid sinus, right? So maxillary sinus, frontal, anterior ethmoid all drains into the middle meatus, okay? And posterior ethmoid drains into the superior meatus, okay? And sphenoid drains into sphenoethmoidal recess, okay? So look at this structure, again little bit of revision. Which sinuses? See here. So this is your nasal septum, right? And nasal septum, lateral to the nasal septum, lateral wall of the nasal cavity, mostly the maxillary sinus, okay? And this is your frontal sinus, okay? This is your sphenoid, this is your pituitary, this is the pituitary stalk, this is the brain stem and spinal cord, ঠিক আছে? So আমরা এখন go into the, this is a better picture. So what is this structure? This one, nasal bone. This is the frontal sinus. This is the anterior plate, okay? Or the anterior wall. This is the posterior wall, right? Okay. And this is your cut section of maxillary sinus, right? These are the ethmoid cells, okay? Anterior group of cells are anterior ethmoid cell, posterior group of cells are posterior ethmoid cell. This is your large sphenoid sinus, okay? This is your, what is this structure? Hard palate, right? এগুলো দাঁত তো, এটা oral cavity, okay? This is your hard palate. It's being composed of, formed by part of the maxillar bone and part of the palatine bone, posteriorly palatine bone, right? What is this structure? I told you this is the pterygoid plate, okay? This is the posterior wall of the maxilla. So this space is known as pterygopalatine fossa, okay? Again, this is your maxillary sinus. All sinuses are lined by mucosa, right? This is your inferior turbinate, this is your middle turbinate, this is the lateral wall, okay? This is the ethmoid group of cells. What is this structure? Orbit, your eye. This is the medial rectus muscle, okay? And there is a thin bone between the, forming the lateral wall of the nasal cavity superiorly, dividing the ethmoid sinus and the orbit. This is known as bolo lamina papyracea, right? So তুমি face surgery করতে গিয়ে এই বোনটা এত thin, you can breach it and go directly into the orbit, right? So this is one of the complications. What is this structure? There is a nerve and there is also a nerve. This is the supraorbital arterial nerve. So what would be, it would be called infraorbital nerve, right? So again, what is this structure? A midline, septum, nasal septum. One by one bolte hobe, speak out, otherwise I will not get motivated, okay? So this is your nasal septum. What is this structure? Ekshate, what is this structure? This one, inferior turbinate, right? Inferior turbinate laterally or below, you can say. This space is inferior meatus. What is this structure? Middle turbinate. So এখানে structure, the below and lateral is middle meatus, তাই তো? This will be asked again and again and again and again in exam. You cannot afford to give a wrong answer to these questions. Straightforward fail. Okay? So এটা কি? Frontal sinus না? তো এখানে brain রয়েছে, frontal sinus and brain, right? And this structure cribriform plate, ethmoid infundibulum we can say, okay? Cribriform plate, olfactory nerves and fibers এখান দিয়ে যায়, তাই তো? এই ছবিটা কখনো ভুল করলে চলবে না, these two pictures, ঠিক আছে? Anatomy will guide you for the surgery and all the complications, তাই তো? We can say that what complications we can have with if we can want to perform a endoscopic sinus surgery. We can damage all these structures, right? We can go to brain, we can have CSF leak, we can injure the orbit, we can have major blood vessels and all around that, okay? So external cavity artery branching পড়ে আসতে বলেছিলাম, পড়া হয়েছে? Yes or no? No, তাহলে আর কিছু করার নেই। Again, বলো দেখি এটা কি? What is this sinus? Huh? Biggest sinus, paranasal sinus. This cheekbone. What is this? Maxillary sinus? কেউ বলতে পারছে না এত পড়ানোর পরেও। How can I proceed further? এটা কি? এই দুটো কি? Orbit. Orbiটের সব এগুলো মাসল, তাই তো? This is medial rectus, this is lateral rectus, তাই তো? Anyway, internal carotid artery branching যখন পড়া হয়নি, সুতরাং this slide is of no use to you. Very interesting slide. Cavernous sinus, okay, area. So next class, sphenoid sinus anatomy আর বলে লাভ নেই তোমাদের। এই স্ট্রাকচারটা দেখতে পাচ্ছ? থাক, ছেড়ে দাও। So there are, our nose is rich in nerve supply, তাই তো? নাকে একটা পোড়া হলেও মানুষ পাগল হয়ে যায়, হয়তো? So there are many nerves around your nasal walls, right? One of them is special sensory nerve, olfactory nerve. It's a special sensory nerve. Okay, we have special senses in our body, right? What are those? What are the special senses? 7-8 class question. Huh? 5 special senses we have. Kiki? Huh? People will laugh at you. আরে চোখে শোনা, কানে দেখা, vision, smell, hearing, taste and touch. তার মধ্যে কটা আছে ইএনটি তে? কি কি আছে? হিয়ারিং, স্মেল আছে, টাচও আছে, টেস্টও আছে, ভিশনও আছে, ওকে? Vision is a shared one, mostly dealt by ophthalmologist. Little's area জানা আছে? আগের দিন nasal septum and blood supply পড়াচ্ছিলাম। Okay, this is the area from which most of the bleeding occurs. Okay, it's a network of vessels. What are the blood supply? What is the blood supply of nasal septum? পড়া হয়েছে? হয়নি। কি কি ভেসেলের নাম বলেছিলাম? Sphenopalatine artery, facial artery থেকে কি ব্রাঞ্চ যায়, anterioethmoidal artery, posterioethmoidal artery. So little area তে সব কটা ভেসেল রয়েছে except posterioethmoidal artery. Very important MCQ question. Okay, like that Woodruff's area is also there. It's a venous plexus situated posteriorly around the inferior turbinate. Okay, which artery is known as artery of epistaxis? আগের দিন বলেছিলাম। So sphenopalatine artery, extremely disappointing. ঠিক আছে? Olfactory pathway, it will be asked in exam. This is a thing, every day a new research paper is being published. It's a genius of physics actually, quantum mechanics. Okay, how it is being done. So these are the thing clinical, coming to the clinical part. What is anosmia? Loss of smell. What is hyposmia? Hypo means reduced sense. Hyperosmia, increased sense. আমার সবাইতেই গন্ধ লাগছে. Phantosmia, phantom means what? Booth. Okay, which is not present, you are getting the smell, right? It's a kind of olfactory hallucination. Cerebral degenerative disease or all, and few intracerebral tumor situated around the olfactory area, we can get this kind of symptoms. Dysosmia. What is dysosmia? Getting a different smell. This means what? This means dysfunctional. I mean altered thing. Okay. So তুমি পারফিউমের গন্ধের মধ্যে একটা অন্যরকম গন্ধ পাচ্ছ. The extreme form is parasmia, right? Absolutely different dimension. ভালো সেন্টকে ভালো সেন্টও পাচ্ছ, but different way that is dysosmia. But if you are getting a different kind of smell, okay, মানে পারফিউম দেওয়া হয়েছে, তুমি পাচ্ছ হয়তো অন্য কিছুর একটা গন্ধ. Okay, that is parasmia. Okay, and cacosmia is foul smell, dead body smell. Okay, that is cacosmia. So how is test our smell, sensation, olfaction? এগুলো এক্সামিনেশনে জেনারেলি জিজ্ঞেস করা হবে না, but at least know this name, UPSIT. Okay, University of Pennsylvania smell detect identification test. Okay, কিভাবে করা হয় না করা হয় এটা খুব অ্যাডভান্স জিনিস. You are not getting the basics. How can I proceed? So clinical situations. What is rhinosinusitis? Rhino means what? Nose. And nose is always related to our paranasal sinuses. Okay, so any inflammatory process in your nose or paranasal sinus is rhinosinusitis. What are the symptoms? First of all, nasal blockage, congestion and obstruction. নাক বন্ধ বন্ধ হয়ে আছে, তাই তো? ভালো নিঃশ্বাস পাচ্ছি না নাকে, পুরো নাক blocked. Okay, this is the first symptom actually. Next, you will have some nasal discharge, right? সর্দি ঝরছে, তাই তো? সর্দিটা যদি পুরুলেন্ট হয়ে যায়, very disturbing thing, তাই না? Purulent discharge means it's secondarily infected with bacteria, তাই তো? Facial pain or pressure, heaviness, নাক পুরো মাথা everything ভারী হয়ে গেছে, তাই তো? Because the ventilation is absolutely deranged, and there will be loss of sensation because the smell of loss of smell. The smell, the air is not getting into the olfactory fibers, cannot reach there, right? So if it is less than 12 weeks, it is acute rhinosinusitis. More than 12 weeks, it is chronic rhinosinusitis. Again, the chronic rhinosinusitis is being subdivided into two parts. If it is with polyps, then chronic rhinosinusitis with polyp, and if it is not, then without polyp. Okay. Why this classification has been developed? Because the treatment will be different for different conditions. Okay. If it's up to 3 weeks, it's acute rhinosinusitis. Okay, and 3 to 12 weeks is subacute. Okay, and more than 12 is chronic. If we want to divide it further, again the treatment will be a little bit different, right? So acute is mostly infective, তাই না? Mostly infective. It can be some virus, it can be some bacteria. Chronic rhinosinusitis is that infection will lead to chronic inflammation, right? So acute inflammation features key. What are the features of acute inflammation? The famous 5 ক্যালোর বলো, প্যাথোলজিতে পড়া হয়েছে তো, হ্যাঁ? ক্যালোর, রিউবর, টিউমার, Latin names, হ্যাঁ? And loss of functionally lossy না কি এটা বলে, loss of function, right? The acute rhinitis can be viral, can be bacterial, can be any chemical irritation, gas, fume, all these things, okay? It's a common cold everybody is having right now, I think, seasonal variations and all, and influenza rhinitis, COVID rhinitis, all the paramyxovirus rhinitis, adenovirus, all these things, and mostly it is associated with exanthemas, right? So, চোখ ফোক লাল হয়ে গেছে, নাকের সামনে লাল হয়ে গেছে, all these things. Famous virus, adeno, picorna, rhino, coxsackie, ecovirus. Airborne contact, droplets mostly in 1 to 4 days incubation period and mostly last 2 to 3 weeks. Clinical features, একই same জিনিসের repetition, more elaborate. What are the clinical features? Water discharge, blocked sensation, stuffiness, তাই না? Sneezing, there can be fever, myalgia, viral, all these things. Systemic features, chills, headache, heaviness, তাই তো? Bad taste, loss of taste, all these things. হেডেকের ক্যারেক্টারটা বুঝতে হবে, হ্যাঁ, সাইনোসাইটিসে, ওকে? বিকজ every specialty more or less deals with headache. Not all headaches are from sinus, তাই তো? Headache characteristic কি? Mostly it's a heaviness, and sometimes if it is acutely infected there can be throbbing sensation as well. But you have to differentiate it from the migraine headache, tension type headache, cluster headache, and a difference will be done, differentiation will be done mostly from the history only, okay? 90% is from the history. Next we will examine that. What are the symptoms of common cold? Again and again, same thing. How will you treat it? You will give no treatment if it is viral, but mostly we get secondary infections, okay? So if in 2 to 3 days the symptoms are getting worsening and purulent secretion is there, we will start antibiotic, okay? As well as you will try to improve the nasal ventilation, okay, so that the paranasal sinuses get ventilated properly. So for that we will give some antihistamine, some nasal decongestions, and some NSAIDs and acetaminophen or paracetamol, all these things. Like in all viral infection, bed rest, little bit of quarantine. It's not quarantine, you should isolate yourself, from at least from the sick people, and increase the fluid intake, right? So there should not be any dehydration, right? And antibiotics. What are the antibiotics? Antibiotics will direct at what are the organisms is there, mostly Streptococcus pyogenes, okay? So we will give beta lactams, right? And if it is, you are allergic to beta lactam, we can give macrolides. What are the complications from simple acute sinusitis? Here comes again the anatomy. That infection can go to the nearby areas, right? So what is the nasopharynx is at the back of the nose. So nasopharyngitis, typically patient বলে আমার নাকতালি জ্বলছে, okay? Pharyngitis, complicated sinusitis, and your ear symptoms. The infection go from via your eustachian tube to your ears. You can have some starting from the salpingitis. Salpingitis means inflammation of the eustachian tube, to otitis media, then to mastoiditis. Your nearby lymph nodes will get enlarged, lymphadenitis. You can have tonsillitis, and ultimately lower respiratory tract infections, okay? You can have all these things. Bacterial rhinitis is more common in children, okay? Children have, especially up to the 6 months, they have natural protections from their mother, right? For the viruses. But for bacteria, the you need to give some time to adapt the immunity, right? We call it adaptive immunity. Okay. So pneumococcus or streptococcus pneumoniae is the most common or causative organism, and the same thing, secondary bacterial rhinitis. Mostly it starts with your viral infection, then quickly get into the bacterial infection, and you can start having complications early. Okay. This is the kind of purulent material coming from the nose, from the sinuses. If you get this kind of purulent material, you should start antibiotic. And sinuses also can get infected. Okay. So different sinuses have different kind of symptoms. Ethmoid sinus, there are some front sinus, I mean anterior sinus, like your anterior ethmoid, your frontal, and all these things. Sphenoid is little bit posterior. So posterior sinuses will have different kind of headache. If all the sinuses are involved, it's called pansinusitis. If 2 or 3 sinuses involved, it's multisinusitis. Okay. If your opening of the sinuses in the inferior meatus or middle meatus or superior meatus, all these openings are blocked, then it's closed sinusitis. This gets complicated mostly because the drainage is hampered, right? So anatomical drainage pathways in the sinuses, again this thing, if it is in the middle meatus, we call it osteomeatal unit. Okay. If it is in the posterior ethmoid or sphenoid area, we call it sphenoethmoidal recess area. Okay. And frontal is nasofrontal duct, ultimately to the middle meatus. Okay. So what are the provoking causes? Most commonly common cold. Your dental source can be also there. Okay. If you are swimming, very frequent swimmers, নোংরা জলে বারবার স্নান করলে you can have this. Diving leads to blockage of the eustachian tube. It can get complicated. Any traumatic cause, and obviously iatrogenic or after the surgery. And if you have deviated nasal septum, the sinuses are clogged often. Okay. The drainage pathway is hampered, so we can have more common, more frequent sinusitis. Also, if you have nasal polyp, that is also obstruction. If you have adenoids, sorry, that is also obstruction. Allergy causes, that is also obstruction. Turbinates are hypertrophied, and post-nasal packing, if there is trauma or anything, and also the packing gives obstruction. And poor general health, like if you have any condition that is that your immunity is deranged little bit. Okay. Don't say HIV always. Diabetes is the most common cause. Okay. And if there is malignancy. So Streptococcus pneumoniae, other bacteria are Haemophilus influenzae, Monaxilla catarrhalis, Streptococcus pyogenes, Staph aureus, Klebsiella, anaerobic organisms, and E. coli as well. Same thing, if there is less ventilation, it will give vasodilation, transduction, and the secretion build up. Again, the ciliary dysfunction, the same stagnation and all. There are famous syndromes. Okay. What are the syndromes? There are few syndromes like cystic fibrosis, right? Where the ciliary dysfunction is there. Coleman syndrome. You know about all these things? Mucous gland dysfunction and viscid fluid. Okay. With age, with repeated infection, your mucous gland can have deranged functions. Okay. How will you examine? First of all, the infected sinus area will be highly painful and tender. Okay. If you have frontal sinus with bending, with your office job, suppose you are sitting for 2 or 3 hours with your head bending position, then you can have this frontal headache. We call it office headache as well. Okay. If your trigeminal nerve is irritated, then you can have pain around the trigeminal distribution. Okay. And this heaviness, if you will have fever, malaise, and all these things. This is polyp. Okay. This is your uncinate process, this is your polyp. This is again, this is your middle terminator, okay. This is the middle meatus area. You are having this secretion and all. Okay. Maxillary sinus, typical headache in malar position, okay. Posterior nasopharynx, upper teeth area, zygoma, temple, all this area. Frontal, forehead, orbit, zygoma and temple area. In ethmoid sinus, nasal bridge, inner canthus, eye movement can also get deranged, okay. If the middle the medial rectus muscle, if it's getting irritated. And sphenoid, mostly retroorbital, pechoner dike headache hoy, and between the eyes, zygoma, all these things, vortex area. So, kothay kothay headache hocche dekhe we can have a clinical idea, right? How do you investigate? First, the basic one, your blood investigations, your biochemistry, your hematology, right? Then the pus can be sent to culture and sensitivity, okay? Then we can have radiology. When we will have radiology? If we get some complications, okay? What radiology? CT scan is preferable, but with X-ray also we can have a little bit idea, okay? But in acute rhinosinusitis, mostly we do not need any radiological investigation. But in chronic, every patient should get a radiological investigation, right? So, এটা দেখতে পাচ্ছ, this is a CT scan, coronal cut, okay. This patient is having, there is a perforation here, septal perforation, and these are all opacities, right? This is black, this is air. Air is the natural content of the paranasal sinus. Here the fluid is built up, right? So, this sinus is actually infected, okay. So, this is right sided maxillary sinus, okay. This is also, these are the, this is the posterior ethmoid area, these limbs and anterior ethmoid area, okay. These are all infected, okay. So, here also both the sinuses having this kind of sinusitis, and this is the nasal septum, it is also little bit deviated, right. How you treat? Same thing. Appropriate antibiotic, decongestion, steam, extremely important, analgesic, and sometimes if the ostium is blocked, drainage pathway is completely blocked, we can have some surgeries like antral lavage, intranasal antrostomy, some trephination of the sinuses and drainage of the sinuses, and proper endoscopic sinus surgery related this kind of surgery, so that we can drain the infected sinus. Okay, if it is recurrent, then we have to address the actual cause. There must be some cause, otherwise it should not be recurrent paranasal, I mean sinusitis at least, okay. So, we should consider if there is any antibiotic resistance or not, or if there is any anatomical obstruction or not, okay. See, this is a beautiful picture, okay. This is a recurrent sinusitis after surgery. It's all open. These are the ethmoid cells. This is the maxillary sinus opening. Still, the patient is developing this thing. What are the complications? Again, orbit can be infected, orbital cellulitis. You can have meningitis if it goes above to the brain. You can have epidural empyema, even brain abscess, cortical venous thrombosis, cavernous venous thrombosis, osteomyelitis, and all the patients of rhinosinusitis with high allergy level, they are mostly have bronchial asthma. It's a common airway disease, okay. So, this is a brain abscess in the frontal area, we call it Pott's puffy tumor. Famous question, it comes in MCQs, okay. Patient is having fever, altered sensorium because frontal part of the brain, his frontal lobe is involved, okay. It is orbital cellulitis. This patient is having meningitis. This is cavernous sinus thrombosis. A patient with proptosis and ptosis in a single patient with this redness. Proptosis means bulging of eye, and ptosis as well, okay. And this redness. First, consider cavernous sinus thrombosis. There is only one condition in the world where the patient is having ptosis and proptosis together. It's mostly involved the cavernous sinus, okay.